Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative, and lifestyle medicine and topics of interest for the individual, society, and the world. I wanted to focus on one topic. Normally, I have many topics in my health letter platform, but this one is on the efficacy and the comparison of the COVID-19 vaccine from Pfizer compared to Moderna. And the article is entitled 12-month all-cause mortality after initial COVID-19 vaccination with the Pfizer BioNTech or messenger RNA 1273 among adults living in Florida. And I'll just read the conclusion, then we'll go backwards. The Florida adults who received the BioNTech, which is the Pfizer vaccine, had significantly higher risk of 12-month all-cause cardiovascular, COVID-19, and non-COVID-19 mortality. That means risk of death compared to those who received the Moderna vaccine. And interestingly, Moderna has more of the active COVID vaccine component in it as far as the amount of content. So what does this mean? Well, this was a huge study. This was 1,470 individuals, and about 735 took the Pfizer vaccine, two of them, 12 months apart, and 735 took the Moderna vaccine. And what they found out is that there was a 37% increase in the Pfizer vaccine of overall death compared to the Moderna vaccine. Cardiovascular death, there was a 53% increase in the in the Pfizer vaccine versus the Moderna. COVID-19 mortality, that means death from COVID, was 88% higher in those who took the Pfizer vaccine than the Moderna vaccine. And non-COVID-19 mortality was 35% higher. Now, the only unfortunate thing is this wasn't compared to 750,000 people who didn't get the vaccine. But what is significant is the great variation just between two vaccines and the risk of death. The Pfizer vaccine risk of death is greater than the Moderna risk of death in this large study. And to put that in perspective, when we look at vaccines death in relationship to world wars, there's a system that we used to surveil and have great respect for is the vaccine adverse events reporting system. And we've done this for I think since the 1990s, and it reviews drugs and vaccines and their deaths and risks. And so until COVID, when COVID showed, when the vaccines came on, these significantly higher spikes, I mean dramatically higher spikes of death, it was kind of a respected system, and now it's kind of downplayed. But if you look at their figures, and I'll have links if you go below in my Substack here, but it's called Vaccine Adverse Events Reporting System U.S. Death Reports. There's 19,355 that are related to the vaccine, the COVID vaccine. Now that is underreported. That's a system where mostly health professionals have to go online and have to do a write-up to document. And to be truthful, most people don't spend the time. So they've estimated that the real amount is 31 times higher. And I don't know how they got that, but that's the estimate. In other words, what they say on there, the 19,355 deaths due to the COVID vaccine is much greater. So that estimate comes out to be 600,000. If we look at all the deaths in World War I in the United States, World War II, and the Vietnam War, it comes out to 580,000. And yet the medical community is silent, not the community that's into looking at the vaccines, but our traditional medical community. There's no intensive study of this and trying to understand this from the traditional medical community. So that's quite remarkable. 600,000 deaths estimated from the COVID vaccine versus 580,000 deaths in all World War I, II, and III combined. So it gets confusing because you go out there in the real world, and one side of the world says, hey, there's nothing wrong with the vaccines. and they keep giving them and pushing them in children and adults, and it just, to me, it's insanity. And many people think this is the greatest biological catastrophe ever in the history of humanity. Very smart scientists. So one place where you can go, it's a World Council for Health, and they have a vaccine report, and they went through four of the major databases: the WHO VIGI Access, the CDC VAERS, the Indra Vigilance, and the UK Yellow Card system. And they come up with the risk factors to taking the vaccine, and they say it's not worth it. That's one thing you can go to. I have a link to that. It's very good. I have a link to VAERS where you can see the United States risk factors and deaths and side effects to different ailments that are related to the vaccine. And lastly, there's an excellent, if you want to just listen to a very incredible speaker, Dr. Peter McCullough, cardiologist, epidemiologist, and internist who's been on the forefront of early treatment, but also logging and reviewing the evidence behind vaccine harm and its ineffectiveness. I put a link to his podcast where he reviews this in detail. So he reviews the questions with a German physician on was there vaccine efficacy, and you would obviously say no. It didn't prevent transmission. It didn't prevent people getting the disease and having the disease, and it didn't. There's no double-blind study that has shown that it prevents hospitalization. Was the vaccine? What are the side effects? And then he goes through that, and he recommends looking at the World Council of Health's COVID-19 vaccine pharmacovigilance report that I just mentioned. And then the author or the interviewer goes, what could we have known? And I answered it just from my own experience in listening to a lot of what professionals like Dr. McCullough have said, very literature cited people. The COVID vaccine did not prevent transmission, maybe initially a little bit, but right away, 6 months later, I got it, and many people did. So it didn't prevent transmission, it didn't prevent you from getting it, and there's no proof that it prevented hospitalization. There's possibly long-term side effects. The spike protein, which is that little spike on the ball, it's altered in the vaccine. That's what gets created in your body. The messenger RNA creates spike protein, and it's altered, and it may last, we don't know how long. And it is one of the most pro-inflammatory compounds ever. It's a toxic compound, and we have it created in our bodies if we have the vaccine. And that's why some people, I measure spike protein antibodies to see the level to see if those people are at higher risk. And I can tell you just by clinical observation that people that get more vaccines have higher levels of the spike protein antibody, which means that your body is responding to a higher level of the spike protein circulating in your body. And it can cause vascular damage. It's inflammatory, causes vascular damage, increases neuroinflammation. Some people believe it causes turbo cancers. So not good. So I would highly recommend that you listen to this podcast by Dr. McCullough if you're worried about citations and bibliographies. The man is a walking bibliophile when he whips out the studies that support these types of concepts. So my name is Kirk Hamilton. It's a hot topic, but I think if you look at the links below in my Substack and then go to them, you will find credibility, and it should make you think that you're not hearing the truth from our medical establishment. You're not hearing anything. So my name is Kirk Hamilton. You have a great day. I'll talk to you soon.